Primary hyperparathyroidism. Now let's imagine a patient who recently had a fracture and evidence of osteoporosis on DEXA scan, which showed T-score of less than -2.5. Also has mild hypercalcemia with an elevated parathyroid hormone levels, which we can also say parathyroid hormone dependent hypercalcemia. So this patient most likely uh, have primary hyperparathyroidism. Now there is alternate diagnosis, which is familial hypocalciuric hypercalcemia, which can also cause parathyroid hormone dependent hypercalcemia, but it is much less common and would be associated with urinary calcium excretion of less than 200 per day and a positive family history. Primary hyperparathyroidism is most commonly due to parathyroid adenoma, which is the most common, but can also be caused by multiglandular parathyroid hyperplasia or rarely parathyroid carcinoma. Primary parathyroid hormone usually is asymptomatic or causes only mild non-specific symptoms such as constipation, and it typically is detected on testing that are performed for other reasons. The other signs and symptoms could be anxiety, depression, fatigue, cognitive dysfunction, somnolence. Renal causes can cause nephrolithiasis, nephrocalcinosis, uh, and polyuria, dehydration, myalgia, arthralgia, bone pain, fractures, abdominal pain, nausea, vomiting, anorexia, pancreatitis, peptic ulcer disease, constipation, and the cardiac causes could be cardiac arrhythmias, muscle weakness, or paresis. So usually the total serum calcium level would be greater than 10.5 in primary hyperparathyroidism, or we can also measure ionized calcium, which would be more than 5.25. And the other etiology could be the medication that could cause this is thiazide diuretics, and other malignancies, granulomatous disorders could cause this. And for the diagnosis, we again emphasizes on the calcium level, the serum parathyroid hormone level. You can also do ECG, which could be evident for QT interval shortening and J waves. There will be bone avulsion. Can undergo DEXA scan to check your T scores. And coming on to the treatment, parathyroidectomy is recommended for patients who have symptomatic hypercalcemia. That could be bone pain, abdominal pain, psychiatric symptoms, or could be considered in complications like osteoporosis, nephrolithiasis, chronic kidney disease, or if there is elevated risk of complication, moderate to severe hypercalcemia, parathyroidectomy is recommended. In addition, patient age less than 50 are likely to develop complications later in the life and should undergo parathyroidectomy even if they are asymptomatic. Usually the patient with osteoporosis with the fragile fracture are required to undergo parathyroidectomy. Thank you.